Cancer is the product of cells in the body growing out of control. Therefore, breast cancer occurs when the cells in the breast tissue of both males and females grow beyond a normal range. Normally, this overgrowth of cells would be naturally controlled by our body, but as the cells develop, they can become too advanced for our body to handle. When you hear the term breast cancer, you probably think of a woman. However, both men and women are at risk for breast cancer because they both have breast tissue. In this diagram, you can see that both men and women have fatty breast tissue as well as breast ducts. However, because women are able to produce milk for feeding an infant, they also have lobules. There are many different types of breast cancer, but the two most common are invasive ductal carcinoma, which occurs when the cancer cells grow outside of the breast duct into other parts of the breast tissue. Invasive ductal carcinoma can be present in both men and women. There is also invasive lobular carcinoma, which occurs when cancer cells spread from the lobules to the breast tissue. Male breast cancer, although possible, is extremely rare. According to a review published in the 2017 Seminars in Oncology, male breast cancer only makes up under 1% of all cancer types found in men. Additionally, male breast cancer makes up less than 1% for all diagnosed cases of breast cancer. Male breast cancer is predominantly caused by a genetic mutation in the BRCA2 gene. This gene is a tumor suppressor, and without it properly functioning, cancer can occur. This is important for men to take note of if anyone else in their family was diagnosed with a BRCA2 cancer. Additionally, men are more at risk for breast cancer if they've been exposed to radiation, have a hormonal imbalance, or are elderly. Breast cancer has the highest incidence rates of all cancer diagnosed in women in the United States. For every 100,000 women, 124.8 of them are diagnosed with breast cancer. Virginia's incidence rate is almost exact to the national incidence rate, with 124.5 women diagnosed with breast cancer per 100,000 every year. Unfortunately, breast cancer also has the second highest mortality rate in the United States for women's cancers. 20.3 women per 100,000 die from breast cancer, only to come second to lung cancer. In Virginia, 21 per 100,000 women die from breast cancer. Breast cancer has many different risk factors, including increasing age or genetic mutation in the BRCA1 or 2 gene. Testing positive for BRCA1 or 2 mutation can increase a woman's risk of developing breast cancer by 65 to 70%. Early menstrual period, late or no pregnancy, and physical activity or obesity are also risk factors for developing cancer. In a study conducted in 2016, researchers found that those who had a physically active lifestyle and healthy eating habits had 30 to 40% lower risk for having breast cancer than those who led sedentary lifestyles. Breast cancer is typically detected when women feel a lump in their breast, and then they will have a breast exam such as a mammogram performed. Then, a biopsy of the breast tissue is taken and examined by a pathologist to determine if the tumor is benign or malignant. If the tumor is malignant, a treatment plan is created. The common treatments for breast cancer include surgery to remove the tumor. This can either be a lumpectomy, which is the removal of just the cancerous tumor as well as any surrounding tissue that may have been infected, or a mastectomy, which is a complete removal of the breast. Breast cancer can also be treated using chemotherapy drugs, radiation, hormone therapy, or targeted therapy. As a caregiver, it is important to know that these women and their families are scared. Be empathetic and make sure that they have resources they need during this difficult time. It is also important to make sure that they are comfortable and have plenty of food and water